I'm Deb Sherman. I'm the HIPAA Privacy Officer at Marlette Regional Hospital, and today I'm going to talk to you about HIPAA. I know, exciting topic. HIPAA came out in 1996. It stands for Health Insurance Portability and Accountability Act. There are three parts we're going to talk about. We're going to talk about privacy, we're going to talk about security, and administration simplification. There are over 300 pages of standards that came out with HIPAA. So one of the standards said that everybody had to be educated on HIPAA, and that includes volunteers, and that's why I'm talking to you today. There was another standard that said we had to have a privacy officer and a security officer. I'm the privacy officer. The security officer is Paul Google, our information technology gentleman. I want to explain a couple things to you. There are penalties for not complying with HIPAA. The penalties can be anything from a $100 violation to $250,000 violation. So it's very important that you do not breach HIPAA. I know you don't know what HIPAA is yet, but let me tell you what it is. HIPAA is protected health information. We have to protect your health information from inappropriate access, use, or disclosure. Okay? What your protected health information, or PHI for short, is, it's anything that's individually identifiable information that's transmitted or maintained at Marlette Hospital. So it's going to be your name, your social security number, your diagnoses, anything that could identify you. Okay? Also, we have to give you a privacy notice when you come to the hospital. The privacy notice tells how we use your protected health information. We only issue that once as you come here as a patient. We use it for treatment, payment, and healthcare operations. And the privacy notice, unless we change something, we don't have to reissue that. I want you to know that there's a difference between a consent and an authorization. A consent says that we can touch you, draw your blood, do an x-ray on you without you suing us for assault and battery. An authorization is you are authorizing somebody to get your health information. You also, one of the HIPAA standards says you have a right to restrict your information. So if you don't want your insurance company to know anything about your HIV treatment, what we do is when we print your record out, we're going to blacken out any information that talks about your HIV diagnosis, any treatment, any medications you're on, and then we would send your information to your insurance company. So you have a right to amend and correct your information. So if you feel something's inaccurate in your record, you come to the Health Information Department. We'll fill out a form for you, or you can fill out a form on the information that you feel is inaccurate. We'll talk to the person that wrote that information about you and get that changed if we can get it changed to more accurately reflect your record, or we'll attach that sheet with the record. And so if anybody requests your records, then we have that in there. There's a really crazy rule that they have. It's a rule that says that we have to keep who accessed your records for 6 years. So anytime you log into that computer, you may be given computer access. We're going to have your username and your password is going to be in that record anytime you look at that record. As a patient, you have a right to opt out of our directory. Our directory is a list of all the patients who's here. So let's say you don't want any visitors and you don't want any telephone calls. That's just fine. You can do that. If later on you change your mind and you decide you want telephone calls or you want visitors, you can change your mind later too. One thing I want you to know is, as a patient, if you opt out of the directory, we cannot acknowledge you're a patient here. So if somebody says, I'd like to see Deb Sherman, we have to say we have no patient there by that name. Marketing, we give nominal things for marketing out. We can only give ink pens, those kinds of things out for marketing. The sanctions here, I know you're all volunteers, but if you look in somebody's record that you're not participating in that care, you will lose your volunteer card, I guess. You won't be able to volunteer here at the hospital anymore. We care very much about patients' privacy. Unless you're participating in the care of the patient, you should not be looking at any records. We do monitor this. We do audits to make sure that people are not looking at information that they shouldn't look at. You are going to have people who are going to ask you, because you're here at the hospital, hey, is so-and-so in the hospital? It's very important that you say Marlette Regional Hospital respects people's privacy. I can't give you that information. And don't confirm or deny that anybody's here. You know, you don't know whether that patient opted out of the directory or not, so you want to make sure that you didn't give any information out. We want people to come here. We want them to feel that their information is secure. Business associates are people that we send your protected health information to, and they have to sign an agreement that says that they will safeguard that information and keep that safe. Under administration simplification, that's another section. There used to be over 400 ways that we sent your information to your insurance company. Now it's on a UBO4, which we use for the hospital, or CMS 1500 claim form. And we have one provider ID number for everybody here at the hospital for all the insurance companies. Now under security, we have to safeguard your information from disaster recovery, password security, protection, login monitoring. We check things like that. We do audit trails to make sure that you are not looking at records that you shouldn't be looking at. And we do have virus protection too out there. Your username is going to be your entire first name and your last name up to so many characters, whatever will fit in there. Your password is your password. Please make sure you do not share it with anybody. Please make sure that you safeguard your password, because we don't want anybody to hack into our system. Complaints. If you have somebody that says to you, I think my privacy's been breached, or how did they find out down at McDonald's that I was in here as a patient, you need to contact us and contact myself at 4213, and we will do an investigation and try and find out how that they found out this information. I know you're not employees, you're volunteers, but we do fire people for breaching HIPAA, so it's very important that you make sure you don't talk about information. Especially, people are going to ask you at the dinner table, so what'd you learn today, or what'd you do today, or if some of you are students and maybe their moms or dads, other people's moms and dads, or maybe other students are in here, you can't confirm or deny that they're a patient here, because you don't know if they opted out of the privacy notice, and maybe they don't want anybody to know that they're here, okay? So it's really important that you don't talk about what you do here, okay? You're going to sign a confidentiality statement when you come to work here that says you're not going to sell my information or anybody's information to the tabloids or any place too. Facebook. I know probably a lot of you have a Facebook account. Please don't talk about any patients, post pictures of you and patients or anything on your Facebook account. Don't Twitter. We ask that Dan doesn't want people to be distracted by social media here, so we ask that you don't use your cell phone when you're supposed to be working. You can look at it at breaks and stuff, but we ask that you kind of don't look at your cell phone while you're supposed to be working. We don't want you distracted by social media. And you are allowed to look at your personal emails, but please make sure you don't have any viruses or anything that you're going to give the hospital. HIPAA is very important. We care about people's privacy. We want to make sure that their information is kept confidential. And so I welcome you to Marlette Hospital. I hope you enjoy volunteering here and you become an employee someday. Thank you.